Okay, welcome everyone. It is September 15th, 2023. We're here for our 2:30 Spokane County Regional Interlocal Leadership Structure meeting. I can never say the acronym, so I'm just saying it all out there. I think we have about 11 people online, and we have Justin and I here in the conference room. So we will go ahead and get started. I just want to say thank you to everybody and welcome today. I do just want to say, you know, I don't even know how to say it. I would like to take a moment and honor Jeff Thomas, who is no longer with us, with a moment of silence. His wife and I actually were in Junior League together 30 years ago, so I've known them for a long time. He was very gracious to me when I first became commissioner, and he has been such a big part of this meeting structure as we've had it over the last several years since I've been commissioner, that I will greatly miss him, and I just would like to take a moment of silence for him. Thank you. With that, we do have business to take care of today, but just, everyone, I know he's heavy on all of our hearts, so thank you for that. And I will turn it over to Justin at this point to run the rest of the meeting.
Excellent. Thank you, Commissioner. Good afternoon, everyone. Justin Johnson, Director of Spokane County's Community Services Department. Thank you all for being here. If you haven't already done so, please go ahead and enter your name and organization in the chat. We'll keep track of all of the attendance there. So again, if you have not done so, please enter your name and organization in the chat. We try to keep these meetings on task, but if there's any questions, please feel free to use your functions, your raise your hand function and the chat function, and we'll try to respond to those as the questions come up or as the time allows. So jumping on to our first topic, we always allow for our state representatives to be able to have a voice here, and actually Amber Leaders with the state graciously agreed to come and present a little bit on the impacts of the recent legislation and the ongoing work for the 988 crisis system redesign. So I'm going to turn it over to Amber.
Hi, everyone. Yeah, Amber Leaders. And I am going to apologize a little bit in advance. We don't have, we have a 988 coordinator in the governor's office, Megan Celadonia, who I think has maybe come to this committee before and presented on 988. So I won't be the best equipped to talk about that particular part of it. But I'm certainly happy to talk about kind of what we're contemplating for the upcoming legislative session. So for anyone who doesn't know me, I'm a senior policy advisor in the governor's policy office, and I cover a variety of topics for him: behavioral health, aging and long-term care, disability, and poverty. And so, but I've been in behavioral health sort of the longest in this role. So, and I'm happy to talk for a few minutes, and then I don't know the format. If you all have questions or want to pose questions back, I'm happy to entertain those if at all helpful. So a couple of things. So we are gearing up for the next legislative session. Behavioral health, I anticipate, will be continue to be a priority of the governor. Governor Inslee has made behavioral health a priority for most of his terms in office, and I anticipate that will continue to be the case here. As I'm sure everyone in this room knows, our behavioral health system is still has, while there has been great investments from the governor and from the legislature over the last several years, there's a long way to go still, and we still have a lot of people who have a lot of needs. I anticipate that we will be focusing in kind of three big areas. There's certainly some things that need to be done as it relates to the forensic side of the system for folks who are kind of have criminal justice involvement with behavioral health needs. I also think that there is a great deal of work to be done on our civil and community system, and some of that is linked to 988 and the crisis system, and making sure that work continues and is built out. And I think the last bucket is really related to sort of, are there policy changes in law and legislation that really need to be furthered? So I think those are going to be some big areas. The other big area that I anticipate being a high priority for us is that we are, as many people are, there is a lot going on, and there are some very concerning trends as it relates to opioids and fentanyl. Overdose deaths are incredibly high. We're seeing a number of communities very significantly impacted. And so I anticipate that we will have significant focus in terms of addressing what's going on with opioids and fentanyl coming up in the next legislative session. Just a little bit about process for us. So we have just this week, agencies have been submitting their decision packages, which are their budget requests and their agency request legislation. So that's what our agencies like DSHS, DOH, Healthcare Authority are putting forward as their recommendations. Those come to the governor's office and the Office of Financial Management, and we do a process of review in terms of putting the governor's budget together, which will come out in December. So we are just sort of kicking off that process. And the first step is going through what the agencies have submitted and reviewing what they have put together as their priorities as we build the budget. So we're sort of in terms of our process, in some ways in the early stages of what we're going to have on deck for 2024. But those are some of the things that I fully expect to be highlights and to be key areas of focus for the governor's office in this upcoming session. And like I said, I'm happy to, again, I'm not totally sure the format, but if there's questions or things that I can answer while I'm here, I'm more than happy to do that.
We're just looking to see if we have any questions in the chat.
Not seeing any questions in the chat. Amber, we appreciate that, the information there. The format of the meeting really is a regional look at the impact, both behavioral health system, and then also the input from the providers and community systems as to what and how those may be impacting in the near future. So either current and or future. So any of those is kind of what we're looking at. And I know that the governor's office is working on existing crisis system redesign work, like at the CRIS committee. Do you have any input or feedback on how that's going, and if we should be able to get a report out from what that's going to look like here in the near future?
Yeah, I think we can do that. So my sense is that it's going well. So I do serve on the steering committee that sort of oversees the CRIS, but I'm not directly on the CRIS. Like I said, we have a 988 coordinator who does a lot of the day-to-day work with the state agencies on what's happening with 988. But I think, there was some legislation passed this last year that moved some things along as it relates to 988. One of those where it was the bill around standing up the 23-hour crisis centers. That's a big piece, as well as doing some more work around the mobile crisis teams and kind of rolling out a different structure for how mobile crisis was going to be involved with 988 and some of these specialized teams that are going to be part of it. So all that work is in progress. I think that's moving along very well. I haven't heard yet whether there's going to need to be additional work this legislative session around 988. There might be, it just hasn't come to my ears yet. And then I will say that, so Megan, who has been in our 988 coordinator position, has announced that she is taking another position with the Department of Corrections. So we will have a vacancy in the 988 coordinator position starting at the end of the month. But as soon as we get the 988 coordinator back in here, we can certainly have them come and do a presentation at one of your quarterly meetings. That would be no problem.
Appreciate that, Amber. Thank you. Any other questions for Amber while she's here? For those on the line or in the chat? Seeing none, allowing for enough time for people to respond. And we really appreciate your time here. We really look forward to having the 988 quarter come and speak whenever the new one is. And we're sad to lose Megan. I know she's been wonderful. So we look forward to whoever that next appointed person is, because this is really going to be the focus of a lot of our region in terms of standing up regional response and enhancing existing systems. And we have a lot of those providers on the call here. It's been a constant conversation and a desire for our region to really have a robust look at what that's going to be here in the future.
Yeah, yep. We'll be more than happy to make that connection and have that person come in. And we can also, the other thing that we can do in the interim, I don't know who might be here from the agencies today, but we also have a lot of expertise in Healthcare Authority and Department of Health in terms of what's going on with the work on the ground and some of the things that are coming up in the future.
Oh, and actually, Amber, one other question that came to mind what is the governor's stance, I guess, or as we look at this legislation, the legislative session for co-responders and the joint partnerships between crisis responders and those being deployed?
That's a good question. I don't know that we have had a full conversation about sort of a policy position. What I can say is that, there's certainly some conversations around that in 988 and in thinking about how the crisis system is going to function in the future. I think, my general sense, just looking sort of at behavioral health policy broadly, is that we have had a lot of success with co-responder models in the past. It's something that has worked well. But I'm also noticing that there's an evolution that's happening as we talk about co-responders in terms of whether or not those relationships should exist, solely with law enforcement, or whether there's an expansion that should happen with other emergency services, or sort of a rethinking. So that's my sense of where we are, is that we have had very good positive outcomes from co-responder teams. We've seen it in the True Blood case in terms of some of the diversion efforts that have happened. But I also think that there's a shift that's occurring as people are thinking about how the system should look in the future. But I don't know that we have, at this time have had a full conversation about what our policy position might be.
Thank you. All right, seeing no other questions. We appreciate your time, Emperor. I know that you have a busy day, so thank you so much for sharing with our group, and we look forward to hearing from the next candidate coordination.
Yeah, thanks for having me.
All right, moving along. I know that we'd reached out to Healthcare Authority. They are also busy and have various meetings going on. These are some carryover topics from previous discussions. So I wanted to bring these back, as the feedback we got from the group was to continue to touch base on these. So I'm going to turn it over to our Healthcare Authority partners. Do you have anyone from Healthcare Authority on the line here to?
Yep, here is Jason McGill from HCA. I think I may be it, but let me just double check. Anybody else from HCA on today? So I know we had some challenges today, particularly from our DBHR team. So for example, I unfortunately do not have an update on Shawila, as I know that has been a critical issue and a critical provider for us. So I will not be able to cover that one. Happy to talk about reprocurement and recertification and the PHE unwind period. That's a pretty critical state, and we could certainly touch on some of the decision package and work we're doing, but we're in very early stages, as you just heard from Amber, in terms of now the governor's office, OFM, thinking through the governor's budget development on that. But happy to touch on some of our proposed priorities for the governor's consideration. Other than that, also here, happy to talk about anything Medicaid, any questions you may have. Where would you like to begin?
Well, I know that there may still be unanswered questions from the last time regarding reprocurement, so that might be a future topic. I know that you guys had touched on, there's still a lot of planning going around that. One of the biggest questions I think that hit our region, and we're expecting not only now, but as it's moving forward, is recertification. How is that process going, and how is that impact to individuals that are located within our service area?
Sure. Can I share my screen for a moment? Is that okay?
Yes, excellent.
I will share with you, and I will provide the link in the chat of this online report with regard to our unwinding efforts. In short, this gives you a snapshot of people who have been disenrolled in this initial period of unwind. It is, 276,000 people. It is a lot. I will say it's actually an under estimate of what it could have been, at least in this very initial stage. We've got many months to go here. However, this initial stage is so critical. In this chart here, gets at this a little bit. So bear with me a moment here. During unwind, we were automatically redetermining people, and only people who have not otherwise entered information in on their own to establish eligibility for a full year period. So for those folks who did not establish eligibility, we automatically redetermine them on a 3-month rolling basis. So for the first 3 months, really April, May, June, July, those are the folks who lost eligibility, and those are the folks who, for the most part, should have lost eligibility. They have probably lost a job during the pandemic, got eligible for Medicaid, and probably are off, on to another job, employed, maybe even have moved out of the state. So for the most part, these folks represented in the blue category are folks we expected to be disenrolled as a result of income and or residency status because they became eligible during the pandemic and now have moved on. Now, August is getting more back to normal. And as you can see, that blue category is much smaller. And the overall disenrollments are much smaller. So we're heading back to normal state here now. And that's really what I wanted to highlight for you overall. This report does divide out by age and by region. So we can take a look at terminations. Here is Spokane, about 4,500. So it gives you some information along those lines. So let me just put that in the chat for you, and you can have that, and we update that on a monthly basis. Let me just pause on that if there are any questions. And I'll go ahead and stop sharing that. So hopefully that gives you a sense of where we're at with Unwind. It is a lot. It may sound like a lot of people, but it is more or less as expected. As I said, actually, we're maybe doing better than expected in the sense of more people enrolled, continuing enrollment, than perhaps what was forecast. Okay, so that process will continue over the remainder of the year into next year, but becoming a much more normal state. And as you can imagine in Medicaid, there is a normal state of people terminating and then people getting back re-enrolled. And I will say too, if people have been disenrolled in this period of time, they can get re-enrolled. And if they need retrospective coverage, up to 120 days, they can get that too. And we have, I think, a historic, extraordinary outreach effort underway. All the managed care plans, the agency, community, all working to help people get that information across. Any questions on that?
Seeing none in the chat or no one raising their hand.
I'm happy to talk about procurement as well. One of our decision packages does set out a potential plan for Washington. I will just be clear though, with unwinding and some of the other demands, we did pause our efforts on reprocurement, and we did need to rethink our timing for that. It was really an all hands effort with regard to unwinding, and we're just now coming up for some air. However, we are also working a lot on our behavioral health issues. We mentioned 988 earlier, just off of our stand up on 988. And Apple Health expansion, another major effort underway, which will be a new product online starting July of next year. And so many demands that we thought prudent to just pause on some of the re-procurement work and reassess our priorities and timing for that. In our thinking along those lines, two thoughts and some critical work from the federal government. So one thought is related to new rules from CMS requiring enhanced quality and accountability, particularly for managed care, and CMS rules related to that. So we have put together a decision package to prepare for that rule. In addition, one of our most important tools to use for accountability is a re-procurement. And as you know, based on our previous conversations, if you were with us, we haven't had a full procurement in over a decade. And so really it is time to consider a procurement for managed care. Nobody probably disputes that. It's just a matter of priority and timing for that. So our decision package also suggests, and as you can imagine, we need some resources to help us think through the priorities for re-procurement, and that's the decision package piece. Not a lot of money there, but a little bit for contract resources to help us through thinking and prioritization for an RFP. And then a timing on that, we would hope to get an RFP in the late 25 range to go live for 27. Now we're open, working with the governor and the legislature and trying to figure out the timing otherwise, but that is our initial proposal to Governor Inslee and the legislature in terms of what we could do with regard to re-procurement. So that's my update on re-procurement for today.
Excellent, Jason. That was very informative. I appreciate that. Gives us a better idea about timeline. And I know with that legislation passed this year, it really helped guide kind of a standard process and gave you guys a lot to think about. So one of the major questions we've gotten in the SCRILS is just how can we be a part and ensure that the local voices continue to be a part of that conversation. And there's a piece of that legislation that very clearly identifies partnership with the healthcare authority in determining local voice and involvement. So really excited to be a part of that and having those continued conversations.
Yes, I think you hit it right on, and that bill, House Bill 1515 from last session, really sets out some major goals and then supports what was our existing effort to not only look at re-procurement overall, more generally, and prioritize this purchasing and contract requirements, oversight and accountability requirements, system design requirements, but look at specifically network adequacy and access to care requirements. And we have a task force underway specific to the network adequacy requirements, and a good representation from across the state on that. So, and then we have a statutory committee that really we use as more or less our advisory committee to help with that work. And that is an open public meeting, and happy to put anybody in touch if you'd like to connect in more to that work. Thank you.
Excellent. Any questions for Jason? See none in the chat or anyone raising their hand. And just lastly, Jason, is there any, I know it's premature, you're working on a lot of different things, anything that we should be aware of or mindful of that for our region regarding the upcoming ledge session?
Yeah, I mean, as Amber mentioned, we're working through our agency decision packages, our proposals to the governor, many packages, even though it is a supplemental session. So a short session, really not a session for incredible new spend or new ideas, but particularly in the behavioral health space, obviously significant need. And as I mentioned about unwinding, we need our resources for unwinding, so that's a package. I mentioned Apple Health expansion work. That's a package. Host of, again, behavioral health work. I mentioned our decision package on managed care quality and reprocurement, of course, as well. Trying to be as focused and diligent as possible in a supplemental session, but also recognizing the needs of the system and thinking through options along those lines very closely with Amber and the governor's office in that regard. So anyway, there's a few highlights. I believe those will all be available soon enough if they're not already on the website. I'm sorry I don't have that. I was just looking to see if we have that all published. I don't think we do yet. So apologies for not having a little bit more detail for you today, but that should be available soon.
We appreciate it. I know that there's, again, we're a little early, but not really
That's
that early, right? So we appreciate that. Again, the HCA does make that available.
I have one other major one along those lines. That's our waiver. You may have heard we have been approved a new significant Medicaid 1115 waiver. That's just the Medicaid law. 1115 is the law that says this federal government can waive certain Medicaid laws to allow states demonstration pilot for reentry and health-related social needs services. I think both areas will have particular regional focus. And in addition to our behavioral health work, of course, with regard to reentry, a very integral connection to behavioral health. And then the HRSN, incredible potential for those non-traditional healthcare services to help people with those health-related social needs. That's HRSN, a new acronym for all of us. HRSN, health-related social needs services. Again, non-traditional healthcare services like nutrition, like non-medical transportation, like respite care. In addition to services that we already have started with our previous waiver, foundational community supports, which helps fund supportive housing and supportive employment. This waiver will add to that 6 months rental subsidies, first and last month rent and supports. In addition, it will support continuation of family caregiver supports in the long-term care area, which is, in my view, one of the most critical waiver services, and respite care and a few others, other HRSN services, health-related social needs services. So we're very pleased about that. But the big, I think, deal is a reentry services for a limited benefit for 90 days prior to release from jail or prison. And why don't I share a slide set with you all on that? I'll send an email after this so you have a little bit more information on that.
Yeah, that would be great, because that was one of the pieces that has been brought up repeatedly, is how will that impact our region, especially for incarcerated individuals needing healthcare coverage and services.
Absolutely, and working very closely with the ACH, the ASO, it will have to be a regional implementation on both fronts, both the reentry service and the HRSN service. Oh, and by the way, community health workers, and working with the ACH to try to stand up good community-based community health worker programs, in addition to supporting clinic-based CHW programs.
Excellent.
So Jason, I've got a couple of questions. This is Commissioner Cuny here. So with the 1115 waiver, it's my understanding that it doesn't go into effect until 2025. Is that correct?
Well, it is in effect now, technically, and for those services that we have already have in place, so foundational community supports or supportive housing and employment, family caregiver supports, that will all continue seamlessly. And then we'll start adding the new services in terms of phasing those in. So for example, reentry, our initial goal would be July 2025 for the first adopters, first jails, first prison facilities, to get ready, to be ready, approved, to start offering services. We have not issued timelines quite as of yet for some of the other new services, so we're working on all of that now and detailing that protocol and timelines, working with our federal partners.
Okay, and then the other question, and so I'm wearing my hat as the WASAC president right now. So I'm president of the County Association. Is also, I mean, the one thing that we keep talking about is that, as far as I understand, the waiver right now on reentry is just on the behavioral health side, not on the entire, on the full health side. Is that
limited
correct?
benefit. Yes.
Okay, because I think we're still trying to push, you know, as the ones who are providing the health services in our county jails, whether it's contracted, you know, in Spokane County through NAFCare, that, you know, we need to get to the whole health, you know, as we get to that behavioral health. So looking at it as the whole systems, you know, the whole health. So anyway, so
Well,
just putting that flag out there.
Yes, I think a very important point, and I don't mean to be, you know, a bearer of bad news, but the feds will not consider more than they are considering now. And so we have the second in-nation waiver on this. That is what we have to focus on for the short term. We can tweak it, but we really cannot ask for anything additional at this stage. It is a full federal government effort from the White House on down to establish the protocols and the framework for the waiver we got. There wasn't a lot of opportunity to ask the feds for anything different, and there will not be a lot of opportunity in the short term. My very clear sense from our federal partners is we got the max we're able to get at this point in time. And we really, my 2 cents on this is, for our focus going forward, it's going to be a huge implementation challenge just standing up this limited benefit. The big deal here is part of the benefit that jails could choose is the full pharmacy benefit in addition to behavioral health. And so that would be a huge help for expense. And so I think that is a lot to focus on, and really would advise us, recommend that we focus on that and do not ask the feds for anything more at this stage. We are not going to get it.
Okay, thank you.
Any other questions for Jason?
Commissioner, can I ask one other question? I heard some confusion on the 90 days as well. Has that come up? Is that of some confusion that would be worthwhile discussing?
Was it, I've only heard, like, sometimes it's been, was it 60 days or 90 days? So I think it was the 90 days was what I've last heard.
There has been some confusion. Originally, the legislation from our legislature, Washington State, was 90 days. No, excuse me, 30 days. Then California came out with 90 days. So we said to the CMS, well, we'd like 90 days if the legislature here in Washington would approve that. And the legislature did. And so we got 90 days.
Okay. And for the most part, in our county jail system, I mean, we don't pre-adjudication. I mean, they're not in our system at the county level versus like what happens at the state level. So so 90 days will be great.
It will be.
But yeah, I think for the most part, our average length of stay right now is about 17 days, and most are, you know, shorter than that, and then we've got our severe issues. So
right, and we think it'll be an average. We don't have to use an eligibility formula for 90 days, so we don't. For the vast majority, as you said, we'll be far under that. We'll be just fine.
Very good. Thank you.
Thank you for the question, Commissioner. Appreciate it.
Mm-hmm.
All right, any other questions for Jason while we still have him? Seeing none in the chat and no raised hands. We very much appreciate your time and for all the information. I also recognize your team is busy and you took time out of your day. So thank you so much, Jason, for joining us and sharing the information.
Very pleased to be with you. Thank you all.
Thank you.
All right. Moving right along here, we recognize that technology has become a really integral part of all physical health and behavioral health treatment services, especially as it pertains to telehealth. And so we've made it kind of a reoccurring thing to bring on board what are we doing in our region to expand access. The county's taking on quite a bit of work, and with partnerships with Broadlink and really piloting this area, we really wanted to bring and make this a focus of our SCRILS look as it again impacts expanded services throughout much of our rural areas. So Ariane, I'm going to turn it over to you to give us an update not only on the recent response to the fires, but also to what is being done on your side.
Well, thank you, Jason. Thank you for having me, both you and Commissioner CUNY. This great updates from the governor's office and Healthcare Authority. And really, I couldn't think of a better segue because really capacity to internet is one of those HRSN, my new acronym for the day, the health related service needs, because once you're home, in order to stay resilient and healthy, if you're not able to connect to the internet, you do have barriers. So that's just a real fascinating takeaway for me. As Jason mentioned, I wanted to share with you a little bit about how we were able to assist the community of Medical Lake in the recent fire situation. We had 2 fires going on simultaneously, as most of you know, and Eastern State Hospital and Lakeland Fire were right in the direct path of the fire in the Medical Lake area called the Gray Fire. And due to a number of constraints, those patients and staff were not able to evacuate. They had to shelter in place. And many of you have heard the heroic stories of how the fire literally went through, and just what an amazing outcome that was. Part of what occurred, though, is although people first and foremost were okay, both Lakeland and Eastern lost all connectivity back to the west side for their electronic medical care system. And they had some PDF paper copies that they were using, but there was a lot of concern given the level of care that many of those patients need, that having a long duration without access to the state system would not be in anyone's best interest. And so Broadlink was contacted. We were working with the Department of Emergency Management and the City of Medical Lake, and we were able to bring in very short order some capacity to raw internet to both Eastern and Lakeland to get them back to the proverbial mothership. And it was an interesting experience for me. My past is in public safety, but I realized that really oftentimes as first responders are doing all that they can for the incident themselves. This fire, both in Medical Lake and the Elk area, were no exception. There's so many needs in the civic side or the care side that it's nice to have some capacity for, and to be able to come alongside. We did go ahead and create capacity for the incident command for that fire response to move back to Medical Lake at the Pine Lodge location, which is also on the Eastern State campus, which was really important because being close to what was occurring in that community was really helpful. And set up a free Wi-Fi for the community of Medical Lake as they're trying to slowly put some pieces back together for a long time. So again, these are part of the things that we're learning, that as we go forward in broadband being the new essential utility, how do we embed this in resiliency for the future in our planning? Justin did ask me to talk a little bit about some of the projects going on, to include the pilot scheduled for South Spokane County. I didn't know if I could share my screen. I have a couple pictures. Aha, something changed. So this particular pilot was an award from the Broadband Office to Spokane County to pilot what is kind of an intermediary technology that's between fiber that would be in the ground or on power poles and wireless towers that are fixed long-term towers that has been coined semi-fixed wireless capacity. And what it is meant to do is bring near term that high capacity internet to an area that, or to an area that doesn't have any, as you're working on the long-term solutions. And then once those are in place, you pick up this equipment and you move it to your next gap. And right now, there's really no clear areas of eligibility and scope in the different notice of funding. And Mark Visconti, who's the director of the Broadband Office, really wanted to have a pilot with documented outcomes so that he could encourage and include in his scoring rubric responses that did include this. So in the Spokane County South pilot, that's really meant to create that resiliency at the household level for anchor institutions and for public safety. And you are square in the household component for that medical health delivery, for mental health, behavioral health, chronic monitoring, and really as we are speaking with care providers, making hospital to the home a reality. So for those of you not familiar with the Spokane area, I'll zoom out a little bit. Those of you that are, this is kind of what this looks like, where we are going to be setting up these towers called Computer on Wheels, or COWS, at all of the fire stations at Fire District 3. Fire District 3 is pretty much the entire southwest quadrant of Spokane County, quite large in geography. It incorporates a school district, Liberty School District, as well as a number of residences throughout that area. These will be strategically placed, and what you're seeing is kind of a coverage map of how really we're able to, in this one fell swoop, cover everything but the Turnbull National Refuge area. And so really this goes from the proverbial 0 to 60 in very short order, while we're looking at where does it make the most sense to put fiber or other long-term point-to-point aerial into that area and others. As I'll just zoom back out, where I was showing you is this south quadrant here. I can draw a picture. This is where our pilot will go. And again, this is where the Medical Lake fire occurred. And then again, the what was called the Oregon or Elk fire up here. So we're really trying to use our resources well in providing internet to our unserved and underserved rural communities, and create that spoke and hub wheel back to the urban core, because that's really where a lot of our providers are. One other thing I just wanted to share, again, the Broadband Office, Mark Visconti, has been really interested in the long-term accessibility and braiding of solutions. What you see up at the top is what occurred this past year, where WSU Extensions partnered with the Broadband Office to create the first set of plans that the Broadband Office is reviewing. As we're going further and further into the future, it really made a lot of sense, and I know this looks familiar to all of you, to maybe do some alignment with some regions that are already established, with other state departments, already have some broadband needs and requirements in the human services aspect, and do some pivots while we're still kind of early in the game in the broadband arena to link arms, in particular with the integrated managed care regions, because Justin is a great example of a BHASO that we really can link arms with. We have Better Health Together as our ACH, and that there's a lot of trust and there's a lot of investments that's gone into what's occurring in our rural areas that we can make sure that we're leveraging as we bring both infrastructure and digital equity solutions. So I guess I share to this group, as I know many of you are in conversations at a wide variety of subjects, if this is something that makes sense and might help leverage, lots of things to do in a little bit of time, and you see some synergies between the SCRILS group and broadband, please feel free to share. I think that, again, we've got a lot to learn from each other, and, Broadlink is just one entity working on behalf of Spokane County, but I'm seeing throughout every county and every tribe, how are we going to make the best of limited resources, lots of needs, and a very short timeline. So that was kind of a high level overview. Again, just to keep in cadence with how we can serve best in the behavioral health and mental health needs. This particular pilot I showed you in the Southeast County does have opportunity for healthcare providers. We're currently talking with MultiCare in creating a hospital to the home pilot. If there's any of you that would like to look into that from a purely behavioral health or mental health side, please let me know. We have funding for the full duration of the pilot that ends in June of 2024. So we would like to extend that for you to vet without having to do any outlay on your own as an organization. So open to any questions, or again, thank you for letting me just share this side of care to our communities.
Excellent. Thank you, Ariane. Any questions or follow-up for Ariane, for those that are on the call? Seeing none on the Zoom and no one raising their hands. Very much appreciate you coming and sharing. Again, telehealth and telecommunications is an integral part of not only physical health, but behavioral health, and it's going to be continuing moving forward. So I envision this is going to be an ongoing topic that we are going to touch from time to time. Very much appreciate your time. Right. And that transitions to our BHASO update. For those that are new or may not know what the BHASO is, the Regional Behavioral Health Administrative Service Organization is operated and managed by the Spokane County Community Services Department under Spokane County, and we help provide crisis services throughout our 6-county region under the regional service area in support and partnership with the healthcare authority. That includes non-Medicaid services, that includes voluntary treatment services, and a wide swath of other avenues. This was a carryover from the BHO and formerly RSN years, and that partnership has continued as we work closely with our frontier rural communities and commissioners and elected officials throughout the area. So very much appreciate the continued support and engagement, especially as we jump more SCRILS. So that's the background of the ASO, and I want to provide an update on that, where we stand, what we're doing, and I'll do it briefly because I know that we've done this from time to time, so I don't want to go into too much depth, kind of get an idea about how things are progressing and how we're working with the state. One of the major updates is just recently we got done with a regional feedback session that was partnered with HCA to look at providers and needs within the region. BHASO helped the HCA provide and facilitate these meetings that directly met with those providers that went out to all of our 6 counties. And the feedback we received from those meetings was wonderful. Provided a really good look at what are the needs that are being impacting our regions, what are the data challenges faced by those providers when they're billing and providing services, both Medicaid and non-Medicaid, and what is the inpatient needs that we're seeing throughout the region. And so that has been rolled up, and I believe that there's going to be more feedback provided as a part of that discussion, but we were able to partake in that and encourage providers to be able to share. So wonderful ability, again, the healthcare authority to continue to support our region by hearing from the voices of the providers on the ground so they can incorporate that in decision-making moving forward. The Regional Behavioral Health Disaster Response Team, which is a regional response of disaster providers who volunteer to support and provide trauma support when a disaster is occurring, either a natural disaster or otherwise. That is run by the BHASO, and it's pushed out to our counties if and when the need arises. We activated here after the regional fires, and so our team was able to go out and participate. Big thank you to our providers who volunteered their time to support us in that way. So for those that have participated or have their providers who have participated, what a wonderful opportunity to partner with emergency management teams, provide trauma care, support, and responsivity to those individuals and to the first responders that are engaged with the response to disaster. Third, our work on the regional crisis system redesign. What does that look like for us? Well, we've been heavily involved with Healthcare Authority and our regional partners as we look to each of the counties and our crisis providers networks, ensuring that not only are we achieving the goals set forth by the state and the legislature to increase access, but also to ensure that those communities that have limited resources continue to have those needs addressed as they arise. So if a need for expanded services, not only for adult or children services, are identified, we have been as responsive as we can to work with our crisis providers to increase either funding and or access and or feedback to the Healthcare Authority as to when those needs. That includes our regional crisis line as we work to integrate with 988, which with FBH is both our 988 hub and our RCL. So we're really unique in this region to have that integrated. FBH has shared on various occasions on what that looks like for them. And in the future, we'll have them come back and share more about the work on the 988 side. That is really involved in ensuring a one stop shopping for individuals who are experiencing behavioral health crisis. They don't have to learn a 10-digit number. They have a 3-digit number. They can get their needs addressed and then immediately be deferred and receive necessary services in our region. That integration process is being led not only by the Healthcare Authority, but also by the BHASO and our partners at FBH. Again, really looking at ensuring the absolute most responsive and best services to the region and the residents that live in it. So we're working on those. It's a lot, especially as we begin developing what that looks like in the near future. And we're also working on increasing access with HCA on inpatient resources. It's no secret that we have lost resources here in recent history with Daybreak closing, with Daybreak closing, FBH's stabilization closing, losing ABHS's COSA 2 years ago. We are at a time where the need is sometimes the greatest, feeling the crunch of limited availability. And our Spokane Regional Stabilization Center, our hospitals, and the ENTs that do exist have had to take the load of all of the need. And especially as we look to the increased challenges faced by the recent Judge Peckman order for True Blood class members, we are at a desperate time to ensure that necessary services are available for all members who need it, either in the front end or on the back end as they transition. So that's work we're doing on the Spokane County side, as well as our partnerships with Department of Health and Healthcare Authority. No easy answers on that one, but we are working diligently to address necessary engagements to provide for those members. And I'd be remiss if I did not include also our managed care organization partners, who are also very involved in ensuring the care and well-being for their members. So again, regional conversations are occurring on an ongoing basis, and the ASO is right in the mix on that to ensure the best possible care for residents throughout the 6-county region. I think oftentimes, even though we have this Spokane County-centric mindset, a lot of the individuals come to services here in the hub. We have a lot of services in our frontier rural communities and in the counties that comprise the regional service area, Adams, Stevens, Ferry, Lincoln, and Pend Oreille, who provide a wealth of services in one of the most challenging situations. So continuing our partnerships with them as well to ensure necessary resources get to the residents that need it. Pause there, I spoke a little quickly, but I want to make sure that we have time to hear from our community stakeholders and partners. Any questions on the ASO, any updates that you'd like to hear from us, anything you'd like to share? And that's just a few of the things that we're hitting on. Again, really looking at a regional approach. We've got a lot of things in the hopper in the coming year as we look to future-oriented engagement. To Commissioner Cooney's State of the County, innovate and collaborate. That has been our mission to Spokane County. And as we look to our frontier rural communities and our county partners in our regional service area, we are continuing to focus on ensuring not only that we innovate in ways that make services better and more accessible, but collaborate to ensure that voices are heard throughout the region. All right. I will transition to our community stakeholders on the line. This is the forum by which we open it up for anyone to have topics that you may want to discuss from things you've heard or things that weren't added to the agenda but you'd like to bring up. So it's an open forum here. So we'll do a first call. First call for any comment or input from community stakeholders. Second call for anyone who wants to share agenda topic in there.
I was gonna say, or even if you got anything exciting happening, let
Yes.
us know. No one's raising their hand.
Any third call. It is a Friday evening, so I do appreciate those that have hung in there.
Yes.
All right, seeing none, giving opportunity. That concludes our meeting. Turn it over to Commissioner Cooney for any last.
It looks like our last item though is that our next meeting is scheduled for December 8th.
I believe so. Oftentimes though, people can't make it because of holidays and or the commissioners are generally busy with other topics. So if it's available and everything aligns, we'll be setting that out. Again, we'll be checking with everyone's schedule. I think last year we had some difficulty with that date, so please bear with us as we look to availability of schedules, but our plan is to have it in early December.
Yeah, so if December 8th doesn't work for people, please let us know so we can look to reschedule. But I would say, I'm gonna just look at my calendar, it's probably on it. So.
And actually, speaking of that, this
Schedule.
December 8th is an important time because that's the time that we discussed last year coming back for revisiting on an annual basis, continuing the SCRILS group and discussing what that looks like. So I believe that was agreed to at our last charter, that we would look at it annually, and that's up for re-review. Not that anyone's suggesting that we change or get rid of the SCRILS, but again, we like to have an annual re-review to say, are we achieving the goals and topics that we want to achieve? And is there still continued regional desire to have the meeting? So look forward to having a discussion on that come December. Excellent.
Yeah. I guess not seeing any other comments or any of that, then we will plan for December 8th. I know it's on my calendar. So if it doesn't work for individuals, please let us know. Again, will be that Friday afternoon at 2:30. I know one topic that I'm gonna see if we can add, I know we talked about at the beginning of the year, but I'd like to kind of revisit kind of our workforce to see where we're at, just because now it's been, I think we talked about that, was it even last fall or was it this spring?
It was, I believe, in our spring, and we had a brief topic on the summer one too.
Yeah, so I think that's something that I know for me as a commissioner, as potential ideas come to us, from other community members, it's good for us just to be reminded as to what the workforce is. For you all know better than I do, and so it's a great topic for me. Just even if we spend 5 minutes or a minute on it, just letting us know if you're still having all the same issues or if it's starting to get better. I know, even if we could get some of the universities to talk about what they're starting to look at and do to try to help, that would be helpful for me if we could just add that as a topic back in December to put on. So. Okay, so it doesn't work for Wes on December 8th. Okay. We'll make a note of that, Wes, and you and I can talk about that offline. And then anyone else, again, please just email, and then it sounds like we'll have a couple of PowerPoints that will get emailed out to everybody. So thank you, Jason McGill, for providing some of your slides, and we'll get those out to everybody as well.
Excellent.
Okay, I think it's 3:30 and we'll let everybody get on to their weekend. Thank you all very much for being here. Appreciate it. And we'll see you back in December.
Thank you.
Take care. Thank you all.